With authorization of a second COVID vaccine, this time by developer Moderna, the U.S. could be well on its way to ending the pandemic. That is, according to medical experts, if enough people actually get the shot. The vaccines from Moderna and Pfizer are very similar in that both are about 95% effective, they use the same mRNA technology, and both require 2 doses. As of right now, the companies combined are anticipated to develop enough vaccines for roughly half of the U.S. population by mid-2021. According to Dr. Anthony Fauci, the nation's top infectious disease expert, 75% of people need to be vaccinated in order for things to go back to normal. Ideally, that could be possible by the end of next year, but now that the vaccines have been developed, health experts face a new challenge: convincing people to receive one. Depending on the poll you read, anywhere between 40 and 50% of Americans say they will not get a coronavirus vaccine if offered, meaning a 75% compliance rate may be unachievable. In response to this, it's possible the vaccine could be required. By who, you might wonder? Businesses, both of their employees and, in some cases, even customers. Are they allowed to do that? Well, currently, COVID vaccines being authorized only for emergency use means there is some gray area, but as the law stands, both public and private businesses can require vaccinations of anyone they hire or do transactions with. In fact, the New York State Bar Association just recently recommended the state make vaccinations mandatory, saying it may be the only way to protect the public with so many people resistant to getting a vaccine voluntarily. Mandates for vaccines, just like with masks and stay-at-home orders, will likely differ state to state, but all are likely to be tracked through interconnected state and federal databases. Who gets vaccinated and where, as well as any follow-up on reactions and second doses, will all be kept in a system. Who all will be authorized access to such a system will be answered in time. Reporting for NewsNet, I'm Abigail Taylor.